It's possible, but I really do think, and I can't speak for all doctors, but I can definitely speak
Not
for
necessarily the doctors, the paramedics, the drivers of the vehicle, the pilots even.
I can definitely speak for our team. We place a premium on human life, and I mean, I know, obviously I employed them, so I know all of our team very well. And they're not only active in the air ambulance, but they're also active in the health advocacy space as well, continually advocating for better health care, continually writing articles that are published in international journals, continually, because what we are, I live in a house full of lawyers, and they say that they're advocates for their clients, but as doctors, we're also advocates. We're advocates for our patients. And we continually, our job is to advocate for better conditions for our patients. And that's why I'm here to advocate to, first of all, show Nigeria what we can do, and then continue to advocate for better care for my patients.
And your question came in, you were, was it a nomination or recommendation on Forbes, the last edition, saying something about your work.
Okay.
Some of the things that people want to know also is about your past work.
Mm-hmm.
You know, because now they're committing their life, which is so valuable, into the hands of your team.
Mm-hmm.
I mean, and then for Forbes to have recommended you like that, that means, you know, you have done something you must have done over the space of time, some really tremendous work. Mm-hmm. Could you talk us through that a little bit?
Work with flying doctors or work before?
Work.
Okay, a brief work history.
Okay.
I went to medical school in England. I started learning to fly in England as well, and I realized that doing a master's in England was going to be very expensive, so I started applying for scholarships all around the world, and I eventually got one in Tokyo in Japan. So I left England and I went to go live in Tokyo to do my master's. And then shortly after that, my sister got very sick. She was in Nigeria and she was terribly ill here, and we're looking for an air ambulance at least to fly her to a city where she could receive treatment, and we couldn't get one. So she actually died in Nigeria at 12 years old. And it was that really it really impacted me in a way. I wasn't thinking about moving back to Nigeria at all, but I think that was a major thing in my life. It made it personal for me, and that was when I decided that I wanted to move to Nigeria and set up. I only actually wanted to set up a pediatric air ambulance service for just children, but then I realized that there were hundreds of adults, children, elderly people dying because they couldn't get to the hospital at the right time. So we decided to expand our scope and make sure we started an organization with the aim of getting every single Nigerian to the right hospital within the right time frame.
Okay. Well, I have like two questions for you.
Okay.
One would have to do with the security situation in the country, the Chibok goals. You talked about it, the work of the security operatives. How, if you had a word for Nigerians and indeed the security operatives, what are you going to say to them? Then the second question is, if we want to reach the air doctors, how can we do that?
Okay. I'll speak, if I had a word for Nigerians. I am quite active on Twitter, and I see a lot of people, there's been a lot of attributing blame. And my true feeling about the situation is, as citizens, as active citizens, we're all responsible. I mean, we're not all Navy SEALs. We don't all know about security. We can't all go into the forest and start handling weapons. But I think that we all have a responsibility to those girls, and we should all be doing whatever we can. And I brought up the sort of my observation earlier that actually we're accusing the government of things, but we as Nigerians, we actually don't have any evidence. I Googled, I'm not sure if I'm right, but have you ever heard of any charities set up by ordinary Nigerians to support the military, medically, you know, psychologically? Are there any big charities? Are there any big events? In England, this is
Maybe
very
they
common.
don't like the media.
In America, they're very common, very common, and they're huge organizations. But in Nigeria, there's not that movement. So that means that sentiment is reflected in us as people, and there are things that we can do to support our boys up there. There are things that we can do to support our military men up there, and I think that it's up to us as citizens, it's up to me as a person, to be doing what I can do, and not just, I mean, it's important to hold the government to account, don't get me wrong, it's a democracy, but it's also important to do whatever we can do to make a change. And sometimes it's even people's movement. The government sometimes follows people's movement. So even maybe if we had these things in place and we had this, you know, citizens approach, this great citizens movement that supported military welfare, maybe, you know, the government would follow suit and start focusing even more on it. But I think that, like I said before, it's really, I think that we all have that responsibility as Nigerian citizens, and I think we can do better. We can all do better.
Thank you. So how do we reach the flying doctors if we need?
Now, like I said, the air ambulance is not for everybody. It's for very specific injuries that can't be reached by road, basically, or it would be difficult, or by severe disasters like a car accident, which has involved like multiple casualties. And an ordinary person is not going to say, okay, I have a neurosurgical injury and I need to go to this particular neurosurgeon, or I have like a myocardial infarction and I need to get to a cath lab. An ordinary citizen is not going to say that. So for now, if it works how we want it to work, it would be a member of either the Road Safety Services, the National Emergency Management Agency, somebody that has the ability to say, okay, you know, this is a diagnosis here.
These are the agencies that can reach you.
Yes, and this patient definitely needs an air ambulance to be moved from this area to the most appropriate hospital for them.
Sorry, that means it can't be done at the site of the incident?
Oh, I mean, they are at the site of the incident.
So, right, an accident happens and I see it's so bad. An ordinary person can't give you a call to say.
No, it has to be triaged.
You have to call the emergency.
It's not something that, and I mean, if you look at air ambulance systems throughout the world, it's very difficult for somebody with no medical training to diagnose a patient and say, this is the kind of injury that needs to be flown, whereas this person can go by road. So it has to be somebody with a specific level of expertise, because it's a scarce resource and a very expensive resource. So it has to be somebody with a certain level of expertise that says, okay, this patient can definitely not go by road. This patient needs to go to a specialist pediatric center, for instance. Like, a lot of surgeons aren't used to operating on very small babies, small anatomy. This person needs to go to this specific surgeon who has an expertise in this area. So it really has to be arranged by one of those type of agencies with the expertise.
All right, thank you very much.
Thank you.
Dr. Ola
Orekunrin,
MD, Flying Doctors Nigeria Limited. Thank you for coming.
Thank you.
We've been speaking with Ola Orekunrin, talking about the value for human life. How much of value do you place on life? Again, we had a conversation before we started, love your neighbor as you love yourself. How much of value do you have for yourself? And
exactly.
How much of value do you
have? The
have?
road to being selfless is being selfish.
I don't know about that, but we'll be back shortly. Please don't go away.
I think.